In every country of the world, the health sector is one of the most significant indicators of national development. A country which has its president consulting foreign hospitals for the best medical attention, while local hospitals rot in inadequate personnel, structure and welfare, isn't one that is enjoying growth. Nigerians are dying every day as a result of preventable diseases. Doctors are leaving in droves. As a result of poor welfare, the health sector is dying slowly, and if not revived now, the ruins may be too hard to bear. On Village Square Africa today, we take a look at Nigeria's health sector and where the country is headed. I'm Sulaiman. Welcome. On August 2, the National Association of Resident Doctors started its strike action. It wasn't the first of its kind, and if the current situation is anything to go by, it won't be the last. Resident doctors in Nigeria make up about 40% of the entire workforce of medical doctors in the country. Now, they're most available in government hospitals, and their absence is always badly felt. As is shown now, the absence of resident doctors is capable of paralyzing the entire health sector in Nigeria. For almost a month, such crucial parts of the medical service provision in the country have been on strike, and hospitals are almost grounded, yet their calls are genuine and expected. Poorly paid, sometimes not paid at all, an older backlog of salaries and poor allowances, these doctors have said they won't get back to work until the government dances to their tunes. A no-work, no-pay policy has also threatened their return to work, and the breakdown in communication is typical of the relationship between trade unions and the Nigerian government. To have a better picture of the actual situation of things in Nigeria's health sector, I have with me three doctors. First, Dr. Tuyi. He's a health policy specialist, and virtually I'll be joined by Dr. Arome Adejo. He's the first vice president, Nigerian Association of Resident Doctors, and Obabire Ayeyemi, who's a general secretary, Association of Resident Doctors at the University of Ilorin Teaching Hospital in Ilorin, also in Nigeria. Gentlemen, welcome to VSA. Let me quickly start here with us in the studios. We've had lots of, back and forth stories regarding the ongoing strike. Okay, I think this should come to the union. Let me start quickly with Adejo, because we should be able to know where the country, where your union is with the Nigerian government at the moment, knowing full well that you've had a series of meetings, or a couple of meetings with the government.
Thank you very much. Good evening, Nigerians. Well, I want to start by apologizing to Nigerians for this avoidable strike action. I want to state that right now, there is no negotiation going at all with the government. And there is a stalemate. That is the present situation.
And this stalemate, if I may also, follow up on that, is it before the no-work, no-pay policy which the government finally activated against members of your union?
Now, let me just give you a brief history so that you understand what I'm saying. We have a memorandum of action which was signed between us and the federal government. And at everything in the memorandum of action, only one was done, and that one was not completely done because one of the CMD, that of Lut, changed the nomenclature of bench fee to training fee. It's an isolated fee, and we cannot dwell with that. Now, the salary of workers, doctors that have been working up to 5 months now in the federal hospitals, UCH, UITH, and from local in some hospitals, have not been paid. Now, the issue of casualization of medical doctors has not been treated. It's unfair that a country that is trying to discourage brain drain will casualize our doctors and pay them half of what other doctors earn, and they do the same work as other doctors. So there is no how this kind of country will discourage brain drain with this kind of issue being played. We also have the issue of the state sanitary centers. Now, the government have said time without number, State institutes are not on concurrent list. Well, they are right. We are not saying they are not right. But we are saying that if health is important to you, you should find a way out of it. The patients that are going to the state home hospitals are not different from the patients that are going to the federal hospital. We are first of all Nigerians before we are from various states. That is number one. Number two, the doctors practicing in state-owned hospitals are not different from the doctors practicing in federal hospitals. And a government that is serious about health care should not segregate state hospital from federal hospital, because health should be number one on the priority list. And healthy nation is the best nation. A nation that is not healthy can never survive. So we don't believe them when they tell us there is nothing they can do. There is something they can do. And we believe that the Minister of Health should play a prominent role in leading the fight for the state institution to be at par with the federal. They will talk of the medical residency training fund. In fact, some federal centers are yet to domesticate the act, like UNIU. They are yet to domesticate the act. All content of the act are not yet domesticated, not even take up payment. So these are the things that we will be active on. Then most importantly, this issue of non-payment of salary is because our members were not migrated from the GiveMe platform into the IPPS platform. These doctors being owned 5 to 6 months are previously on a platform called the GiveMe platform. Then the federal government said that that platform is a corrupt platform, that people are using it for corruption, and it's costing the nation a huge sum of cash. We support the migration wholeheartedly, but instead of them migrating our members or paying them while the migration lasts, they refuse to migrate and they stop payment. That is inhuman.
Let me come in here quickly, because I think we've been able to get some of the complaints here. I'm trying to see how much of time we can take in the next few minutes. We have just an hour to deal with this. And let me bring in Dr. Ayeyemi here. And some of the complaints tabled by your association is the non-payment of the COVID-19 allowances and even hazard allowances. Has the government made any efforts to seek resolutions, especially to this all-important issue, knowing full well that the country, just like the entire world, is in the fight against the pandemic?
Well, so far, the government has not completely done what they're supposed to do in terms with this, the COVID inducement allowance and the hazard allowance. For example, the hazard allowance negotiations is currently stalled, and we don't know where the government is going to go next for that. Meanwhile, so many of them, including members in my own hospital, are still yet to be allowances from last year, which was to other places. And this is something like a minor issue that should be easy to deal with. However, after months of engagement, we still the issues are still not being sorted out properly.
Well, I think, let me come to the studios now with Dr. Tuyi. You've had your colleagues, and I know you've been my guest live on the Continental Prime here, and we discussed some of the key issues, especially. Let's start by asking, how did you feel when you saw your colleagues, out in public, working out, to see how they can leave the country? Now, we're talking about brain drain, which is very important that the country starts looking at. These two members, your colleague, have been able to tell the nation and Africa what we're dealing with. But the ultimate point here now is that we've seen doctors now leaving out, leaving the country in droves. First, I want your feeling, and so that we can start putting some of the key concerns.
It's actually an issue of serious concern. Why is there an issue of serious concern? Well, first and foremost, we look up to the experts, the doctors, in their various areas of competence to be able to wait and fix the health system in Nigeria and raise it to a standard that can be enviable. It's not that a lot of us don't really have chance or opportunities to work outside. We figure out that, wait a minute, we could still contribute something. We could still actually push our health system to an enviable level because, again, let's face it, India was not better than us 20 years ago, but now it's become a destination. So what are the things that actually needs to be done? And the big elephant in the room is government. It's government. You see how they have, the markets, how have they denigrated, the health system by not patronizing the health system they created. If you deserve the political post, you deserve the health system running in that place. So why are you running around? So the first casualty, the first issue here is this. Government chose to run out of the country, the political leadership, the business leaders, the elites chose to run out of the country to go and patronize health system elsewhere. Then you cannot then blame the doctors for wanting to run out of the country. Perhaps they meet those political leaders and treat them there, since that's where they are comfortable. So now, the next thing that became so troublesome is the fact that government woke up and said, no work, no pay. Please, what of no pay? If there's no pay, can I work? If there's no work, no pay, then there should be no pay, no work. Because if you're not paying me, you're telling me not to work. Obviously. So it's not just one side, no work, no pay. Also no pay, no work. Because you are the one not paying me. You started the fire by not paying me. So why do you want me to work? Why now go back to the no work, no pay? The third simple thing is that if you look at the structure of health system, if you look at the critical 5 knobs of health reforms, even if you fix the doctors completely, you have not solved health problem. I mean, let's just put this in perspective. Let's look at it and say that, listen, all the doctors are collecting wonderful salaries. They have good things to work with. You have not fixed the health system because there are critical issues involved in the health system. What you are seeing, most of the things these doctors are complaining about, or we doctors are complaining about right now, has to do with governance and leadership in the health system. It has to do with health politics and the policy of health politics affecting health policy. The greatest problem of health policy is health politics. Because whenever you see money being allocated to any system, there will be politics there. And you have to learn how to play the politics. So leadership is key. Leadership will ensure that this migration ensure that people get money. Leadership will ensure that we ensure harmony within the working system of the health system. But even beyond that, leadership will ensure that the proper payment mechanisms. Why do you want to make everything pecuniary for doctors? Doctors, what are your challenges? You have 2 children, we're going to give them scholarship to the university, 2 of your children. That is an incentive to stay. We're going to give you a house that you can stay, and then after 10 years you've worked, we will upgrade this thing and change your vehicle. That is an incentive to stay. But what we have seen is people bereft of deep thoughts on how to change the health system. And actually, what should happen exactly is this. You have primary healthcare system, 30,000 of them, less than 6,000 working. You should have focused on how at least 70, 80, 90% of the primary healthcare system will work in a nation so that you reduce the loads on the tertiary system. The primary is not working. People abandon the primary and run to secondary and tertiary and put loads on these doctors. So if you are not defining those things clearly, if you are not getting right the policy, because when you are talking about health as a system, you are talking about philosophy of health, which is ethics, process, and people. Kitting. Now, what we are dealing with is that we don't even need to define the ethics of health system in Nigeria. What should be the priority? How do we address our negative health indices? What are the things we are going to use? The money we have, how do you maximally get the right bank for the box we are putting in this thing? You've not addressed that. You know why we're not getting that right? Because there's no proper leadership and governance in health system. And the political leadership has done the worst to the health system. So now, yes, it's nice for us to desire that doctors get paid and retain in this country, but I can tell you the health system goes beyond doctors getting appropriate pay. If you don't address everything properly, they will get paid properly, nurses will go on strike, lab people will go on strike, the primary healthcare system will not be working, and then people will not contribute the right money for the political leadership will still have sprain and run to Dubai and run to anywhere and London and
I'll come back to you. I'll come to you because we'll start, on the other half, we'll start talking about some solutions, just establishing some of the key concerns here. Let me quickly go back to Dr. Adejo. And Dr. Adejo, you've heard Dr. Tuyi and your colleague Ayeyemi, and the issue here now. First, you work in those hospitals, and you're very close to the patients. You started by actually tendering an apology to the Nigerian people. So tell the Nigerian people or Africa the true state of Nigeria's health sector, apart from your demands.
Thank you very much once again. I didn't actually listen to all they had to say because I had some network issue. And actually, the state of our hospitals in this country is not the right way. As far as I'm concerned, I don't think I can count up to 3 hospitals that are even very neat, but still very neat in this country. Compare, then let's not even talk of the facilities. Now, most of our tertiary centers, the tertiary centers are supposed to be the best hospitals, the teaching hospitals. Most of them don't even have a functional CT scan. A functional CT scan. When you go in there, what you find is an archaic and antiquated CT scan. Now, some of them are even bad that in a week, the X-ray machine breaks down repeatedly. Now, when you have a trauma case, when you have an accident case, and you have a head trauma, the gold standard is CT scan. And in most hospitals, the patients are referred outside in an unconscious state to do a CT scan. I remember as far back as 2011, when I was an house officer at FMC, Lokoja, we used to refer our patients to Abuja or Kwara State, Ilorin, for a CT scan. Can you imagine? 2 to 3 hours journey for a CT scan. How would that patient survive? So if the tertiary centers cannot have a functional CT scan, and some of them don't even have a good X-ray machine, then that tells the state of the hospital. Now, in some hospitals, gloves that we wear are prescribed to patients. Is that normal? Patients have to buy gloves that the doctors wear to take care of them. I remember then when I just came back from abroad that I used to change my glove whenever I touch any patient. My HOD had to shout to me and tell me when next I do that, he's going to find me to buy a packet of gloves for the hospital. That is as bad as it is. So if we cannot get gloves everywhere, free in the hospital, then is it an X-ray? Is it a CT scan? So let me tell you, the state of our hospital is nothing to write home about. I'm even ashamed, so I don't even talk much because I am a patriotic Nigerian.
Patriotism doesn't mean that, well, we won't, it's the same patriotic, zeal that has brought us here, and that is why we're discussing this. I'm also an African, and I'm also concerned. If I fall ill, I'll be looking to using any of these facilities you just described. So let me bring in Dr. Ayeyemi here, and, listening to your colleagues, one should be a little bit worried, knowing full well that you have others who are already out, some on their way out, and much more, some in schools asking if truly this can change. Now, this is taking us to talking about solutions. How can things be reversed? You've had Dr. Tuyi, especially, he gave a perspective which he calls the politics, of health in the health sector and how people are pursuing this. Most Nigerian doctors, they say, are overworked because of the inadequate numbers, and the country is already losing some outside, and many still will leave. So let's start talking about some key things that will make some of these, these colleagues of yours stay back while the country looks to seeing if some of them can return, just as Dr. Adejo did return back then. I just hope that he's not regretting coming back to Nigeria. But first, Dr. Ayeyemi.
All right, thank you. I think the solutions are quite clear. And like Dr. Tuyi said, that the elephant in the room is the government, because the role they have to play, the most important and the most crucial one. For example, on a holistic level, they need to take care of Nigerians very well. They need to improve security situation of other general indices. That aside, going now with specifics, we need to find ways to ensure that the working conditions, the conditions of our hospitals are, at least decent standard. Hospitals where patients can come and receive quality care. Not the kind of care where the doctor is overstretched beyond the limit, he doesn't have tools to work with. That's one of the factors that push doctors to leave the country. When you work in a place where you have a patient, you need an investigation done within the hour, and then you have to wait for the investigation. I think we need to look into that. And to solve that, I think there's a lot the government can do, expanding the reach of health insurance, sanitizing the health insurance, encouraging the private sector to invest more in the healthcare system. And those are things that we can do to improve the quality of hospitals that we have. I think one other thing also is something that was mentioned earlier, the fact that our government officials seem to have made a statement of their behavior that the health sector in Nigeria is a write-off. The fact that the of the country has any slight pretext just to have some out there. And you'll be surprised to find out that it's our colleagues who left the country that they go to meet those countries where they go to. So if they provide an enabling environment for us to practice, we can actually get best quality health, because we have the best things right there in Nigeria. But the problem is just that the environment is not that suitable. So we need to also discourage it. We need to get our politicians, our leaders, to patronize the health sector in Nigeria. Perhaps if they come to the hospitals regularly and face what the ordinary Nigerians face, that would encourage them to invest more time, more money, and more to ensure that.
Let me come in there. Apologies for butting in there quickly here, because you're the General Secretary of your association at the University of Ilorin Teaching Hospital. Quickly here, and perhaps you've also heard the argument from some Africans and Nigerians saying the medical profession shouldn't be one that should go on strike. They think that there are some unions, there must be some kind of professions whereby people are exempted from going on strike. So they think what you're doing now is selfish. Do you think strikes like this present one can help solve the issues you clamor against?
Well, there are always two sides to any argument, and I will present our own side. I want everybody listening to imagine themselves as a doctor. You know, you go through 10-hour days, 16-hour days, sometimes 24-hour days at work. You have nothing else that you can do to fetch your money, and you only believe that at the end of the day, you're going to get your salary so that you can meet up your obligations. And then for 8 months, you do not get your salary as at when due, and you do not know when that situation is going to end. How do you then keep on giving proper care to the patients that want to see you? That's the situation where we are in. The demands we are making, salary is just one of those demands. You know, imagine the families of doctors that have died in the course of their duty, died due to COVID, died due to Lassa fever and other dangerous diseases that we face. The health in the life insurance, which has been the policy which has been made already for this kind of eventualities, and the families of these doctors are yet to receive this the payout from these policies. More than a year, some 2 years or more since the doctors died, and then you know, it's difficult to encourage us to deliver the proper care when these are the conditions in which we work. And then at the end of the day, we understand that the service we provide is very important and is very, very essential. However, we need to take care of ourselves first before we can take care of anybody. Even the Hippocratic oath that we swear to when we become doctors admonishes us that we must take care of our own health, our well-being, and our abilities, because it is only when we are doing well, when we are okay, that's the only time we can give the proper health care to other people.
Let me stop you here. Again, apologies for butting in. When we come back, we'll take in a moment. When we'll come back, I want Dr. Tuyi to also weigh in on this and see if calling for strike action is the only alternative to fixing the myriad of problems as identified by all three doctors here on VSA, plus solutions to these problems. That's when we return. The home run here on VSA, looking at the health sector in Nigeria. You know, the country has some of the finest medical brains in the world and are known to be some of the best surgeons in the world as well. Many of the Nigerian registered doctors now work in foreign hospitals, and many more still want to go. The Nigerian government, although it is attempting to stop doctors from leaving the country, is not solving why they leave in the country. You heard our guest highlight the deplorable state of many hospitals, whether the primary, tertiary, or even the secondary health facilities. They're all in shambles. With the pressure of the society heavy on their respected shoulders, talking about the doctors, they find it hard to live up to billing, working long hours, but getting poor salaries and wages, exposed to different diseases, just as we've seen in the fight against COVID-19. Like the tired doctors, the structures are weak, abandoned, or altogether absent, and Nigeria's health sector, many say, should be reformed, revamped, and restructured for optimal performance. In an age of emerging and re-emerging diseases, Nigeria can't afford to sleep on its health sector. Still have with me Dr. Tuyi Mebawondu. He's a health policy specialist, and virtually Arome Adejo, the first Vice President, Nigerian Association of Resident Doctors, and Obabire Ayeyemi, who is the General Secretary, Association of Resident Doctors at the University of Ilorin Teaching Hospital, Ilorin. Gentlemen, thank you for your time and thank you for still being there. Quickly here, I said I was coming to start with you, listening to your colleagues, and they reeled out these, concerns and problems, and some you already know. And you also highlighted something in your statement then, that once upon a time, a lot of these countries who are mopping up Nigerian doctors were coming down, for medical tourism, but the reverse is the case now. How can we change the course?
Well, obviously, the present health system that we're practicing is not working. Essentially, it's not about your GDP, because you look at Cuba, okay, you look at even Bangladesh, some of those small countries, you know, with similar GDP to Nigeria, doing well health-wise. It's just priorities, it's just attention. It's just somebody understanding the place of health, both in development, civilization, and economic prosperity. For you to understand that the new challenge now is not guns, it's not tankers, it's not those armory. The new challenge, they are health, human resources. Because you saw essentially when the COVID came, economic lockdown, country went into recession. If you then don't understand that the new warfare is non-kinetic and it involves essentially how you structure your health system and seeing how the interplay of health and development. If you cannot understand that, then we have a big problem. So again, if you're looking at the system and you say, okay, we're having this huge challenge of the health, you feel for the critical thing you need to address is how do I finance health? Health financing, because look at what the doctors are talking about. The bedrock is still finance. Now, you wake up, you budget 8 naira for every Nigerian this year. 8 naira means that including the money the doctor is going to be paid, the ambulance, the running of the hospital, it's 8 naira per individual in a country. Okay? What would that do? You have vaccination there.
But again, sorry to cut you. Don't the doctors, don't the government know this? Because for the first time in the history of Nigeria, your profession, you know, has 3 experts in government overseeing, for instance, this issue. We're talking about the health sector with 2 doctors. The minister and the minister of state. And you have the man in charge of labor, who is also a medical doctor. All 3, at least one, if not all, should see some of the concerns you're raising.
Yeah, of course, no doubt. They all know the concern. They still know it. They saw it, they still know it. But I've said something. Health politics is a huge issue. The politics of health, you know, kind of impact on the policy of health. Now, you have money, you are allocating, and they say, okay, this is all the money we got. Okay, though we've committed to 15%, you know, in 2000, Abuja Declaration, and all we could do this year is 3.2% or 3.4%, as the case may be, 300 and something. Most of them are recurrent expenditure. We cannot really actually do much, okay? And they said, this is the money we have. What are you going to do with it? You know, and then secondly, we've seen that politics has become issue of what is in it for me, WIIFM. So
what did you call that again?
It's an FM station, WIIFM. What is in it for me? So in a way, in such a way that what you've seen is that
that's another word for corruption.
Yes, you know, if you, what happens is that if you are made minister, there are people killed behind, I made you minister. There are people killed behind, you are from my village. There are people killed behind, so that this is how it is. Where are we getting for our geopolitics and our religion? So all those things that corrupted the whole health policy, as it were. Now, if you get to that point, and then you look at the health dynamics, the population is growing at as much as 4-5%. Where is the health system to cope with this? And you also look at the critical training capabilities. Because number one, if you're in secondary school and you're not doing science, you can't become health worker, obviously. And you see that the secondary school is not being encouraged to pick up science. No incentives for growing up secondary to pick up science. That's a problem. And then you are looking at the capability of university to absorb and train doctors. That is decimated completely. You know, tell you what, the man that actually, Olunyinka Olutoye, who did the surgery on a baby, returned the baby back.
The fetus back.
The fetus back to, you know, to be born at the time. We were classmates. We were classmates in Ife. we entered Ife and left Ife together. So for me now, it's actually a problem for me that I have chosen to hang out here. But who is going to solve the problem of the country? So health financing, then you have to create health leadership. The critical thing is for us to go back to that basic primary health care concern, where 80% of the population can be taken care of at the local level. I expect this government, a serious government for that matter, to look at how to link everybody. You are sitting down here, you must have a doctor that's linked to you at the local level first. So the doctor helps you, a referral system that takes you if you need a secondary attention or a tertiary attention. So then you look at a lot of money coming into agric, a lot of money coming into other endeavors, infrastructure, Where is the money coming to health? Nobody wants to invest in health. But I can tell you that in a place like India, health is a very, very, very big business. So you at the level of tertiary and the training, we're looking at even entrepreneurs to say that, guys, wait a minute, how do we raise a standard health that can compete with Hama Memorial, Mount Sinai, and this hospital everywhere, okay, or Mayo Clinic? How do we raise that kind of standard hospital? And then I'm putting my investment. Where are the incentives for government to ensure that that investment goes into health, okay, and then people can then recoup whatever they invested over a lengthy period of time. And then the insurance system, less than 2% coverage, national insurance health policy, less than 2% coverage, 2% of Nigeria, and most of them are city dwellers. The rural people have been neglected and bounded and thrown under the trailer. So, in a way, the policy is wrong, the financing is wrong, the leadership is not proper, okay, and even the process of payment. Resident doctors, guys, since you're a resident doctor, what are your major concerns? You need accommodation. Build houses for these guys. Let them stay there. If they want to continue, they hold on to the houses. When they graduate to a certain level and have children, they start having children, then they now qualify for 4-bedroom flat, and then we give them vehicles, simple vehicles. You then go ahead and buy vehicles for National Assembly people that already have vehicles. How do you, so if you're not doing that, if you're not taking of that kind of fundamental things to touch health people, you would not get the health system right. So it's a lot of things that we need to sit down and critically look at funding and look at human resources for health and look at leadership and organization of health.
I'll come back to you, Dr. Tuyi, so that we can also, talk more about the government angle. And I'd like you to expatiate and tell us more. Let's quickly go to Dr. Adejo. Dr. Adejo, as we draw in this, it's something that really breaks every African, every Nigerian listening to all three of you talk about the all-important sector of any nation, the health sector. Perhaps let's start talking about how first some of the things can be resolved with your union, because we'll come back to Dr. Tuyi and also wrap up with you people. Now that there is there seems to be a stalemate in the conversation between the government of Nigeria and your union, what should Nigeria or Nigerians be expecting of your body? Are we likely to see another window of conversation or a glimpse or a ray of hope of your members coming back anytime soon?
Well, the truth is that we are open to negotiation and we are open to talks. Well, I want to let you know that there is no how we can tell our members to come back to work when it's obvious that they are very hungry. There is no how we can tell a doctor that does not have a station to come back to work. There is no how we can tell a doctor that has been strength that children are yet to go back to school because he has not been fixed to go back to work.
I think I'm having some. There's an audio glitch. There's a glitch on the audio connection. Let's see if we can get that right. Can you hear me now, Dr. Arome?
Yeah, can you hear me?
Well, there's a slur in the connection on your audio. Perhaps we should connect, back again. Perhaps if you can log off and come back in while I have my conversation with Dr. Ayeyemi. Well, Dr. Ayeyemi, I hope the connection is still okay to your base at the in Kwara State. Quickly here, we're talking about how we can get out of this, how Nigeria and Nigerians can get out of this. You're Secretary General of the Association at the University of Ilorin Teaching Hospital. But I was able to get a sense of what Dr. Adejo was saying, that it doesn't look like your union will be calling off the strike. Tell us more.
Right now, the ball is in the court of the government because we have made our demands clear, and I think you would agree with me that the demands are quite reasonable. Even though those demands are quite reasonable, We are still open to negotiation. There is no time they will ever call us to discuss and talk about this. We would not be happy to sit with them and discuss, because we also do not like being on strike. So as far as I can tell, if the government is able to sort out all these problems or give evidence that these problems are really going to be sorted out properly and adequately, then we will be willing to go back to work. But a lot of us enjoy the work. We see the job as a calling, as to help people maintain their health status. So we are happy to go back to work. But the ball is in the court of the government, and they have to do needful. They have to do the right thing, and they need. We also need so many Nigerians to call on the government and all its actors, the ministers, and the head of service. They should, and the state governors too. They should all sort out and solve this problem that we have laid before them, so that we can go back to work and Nigerians can keep the health system the way it should be.
Well, in our world, in our today's world, a lot of issues are placed, on the doorstep of mental health. Time was, the world talks about burnout syndrome. But, with all of these issues painted and highlighted by you all, what effect does it have on your mental health?
Well, it has a negative effect, that's certain, because normally everybody should have time out from work. Everybody should be able to enjoy holidays. They should be able to enjoy time to rest and relax, so that they can come back to work fully refreshed and energized and ready to work again. However, with the current situation of that's a luxury for most of us in the health sector, especially doctors. We work 8 to 5 every day, and then we take calls in the evening and on weekends too. For example, a lot of us, due to these effects, we've been experiencing a lot of stress-related problems. Currently, the Nigerian Association of Resident Doctors has a research collaboration that is scientifically exploring these issues, because burnout is associated with so many stress-related problems, from mental illnesses, anxiety, acute stress disorders, COVID depression. These are mental issues that could be a direct factor in stress-related with excessive stress. Firstly, insomnia also. These are issues, and some of our members occasionally suffer from this problem due to the effect of being overworked.
Let me bring in Dr. Tuyi here quickly, and it has to do with what we see almost all the time. You made mention of some of these hospitals, Mayo Clinic, and Herman Memorial, and a few others. But Nigerians travel abroad all the time. Sorry about that. Nigerians travel all the time. And do you think Nigeria has what it takes to become one of the best in terms of health in the world? Can we go back to the days of old?
Why not? We can actually get to that point where we become the darlings of the whole world. Because we have the right human resources, and then it's just because to put everything in shape so that we can then flow along. But again, I expect that the consumers of health should come out and demand that government should do something. They have the knife, they have the yam. They should be able to call these doctors and say, listen, guys, let's talk. Let's get this. Let's set this thing aside for you. And then we hope that you're going to do something.
Politics, which you also highlighted, is very important here. And some of the things that Nigerians also worry about, it has to do with, you also made mention of that, has to do with showing an example, the political will, an interest in the sector. If you're not excited about the sector, then you go outside and seek medical attention. African leaders always go outside the continent to seek medical attention, Nigeria's president inclusive. So will it make any difference if politicians, leaders, utilize or patronize the national or local health, facilities or sector?
That is my first recommendation. If you're going to lead this country in whatever capacity, if you're going to be a minister, if you're going to be a House of Rep, House of Senate, or whatever, governor or commissioner, the first prerequisite is that you must patronize, one, the schools in this country, and secondly, the hospital in this country. Okay, let's start from there. Because, growing up, I had children of different categories of people in the nation. In my secondary school, government college, K2, yes, was a boarding house. Even Odogbolu dead, everybody is reflected there. There's no big deal. You come, you drop your words, and then you go back, and then it's taught like every other person. So now, suddenly, we just felt that, you see, they can go to hell. We are different set of people. In such a way that, for me, the NMA should be part of the people to recommend any political officer for treatment abroad. We should make such a law in such a way that for you, as a political officer, as a political leader or whatever, NMA must actually certify that you're fit to go abroad because we don't have those requisite places to treat you here. Now, look at big institutions in Nigeria that are doing a lot of things. The central bank is putting a lot of money into so many things. Okay, tell me, what is wrong in central bank waking up and saying that, listen, we're going to build standard hospital, well-equipped, well-funded, into one in the north, one in the south. Okay, NIPC declared massive profit now. What is wrong in NIPC saying that, listen, we're going to build an epical referral center, and in that way, we twin with a big hospital abroad, okay, so that we can exchange, knowledge. Our resident doctors can also be raised up in their capability and capacity, okay? What is wrong? Because, tell you what, Nigeria spent $1 billion every year to go abroad to access health care. Okay, imagine $1 billion, half of that in our economy, what that means, okay? $500 million in our economy every year. By those people that have the means, that will transform some critical thing in the health system. So if we're not thinking of such deliberate intervention in the health system, for instance, why can't even some of those big institutions adopt University of Benin Teaching Hospital and say that, listen, this teaching hospital must measure to every standard possible. Now, you see the primary health care center neglected, abandoned, dirty, no human resources to do anything, even you don't want to take your goat there to be treated. Why can't, as a CSR, for one institution, to adopt 2 or 3 primary health care centers and use them as a signal, and use them as an example of what the primary health care center should look like? So everybody has felt that, well, it's none of my business, and that's why they won't give a shit. Sorry for using that word. Sorry. They won't give a damn, They won't give a damn, okay?
Yeah.
If the health system is not fixed, if the doctors are on strike.
Let me bring in Dr. Adejo here. Apologies to our viewers. Quickly, Dr. Adejo, I hope the audio connection to you. So I'll let you complete that so that we can close. Tell us some of those key things that are expected to making this work for Nigerians. Talking about the conversation with the government of Nigeria.
Well, I hope you can.
Absolutely, I can hear you now.
Right. I want to state that the government is not serious about the health policies. Because if it is serious, it will not allow to stop.
Not again. I think it looks like all 3 of us can't hear you, Dr. Arome. There seemed to be another glitch. We lost the audio to that. So quickly, let's close with you, Dr. Ayeyemi. Tell us, in your closing, what should we expect? Because now we understand your parent body, the Nigerian Medical Association, has said it will be joining in solidarity with the resident doctors. This spells doom if nothing is done for Nigerians.
I hope that will serve as a wake-up call to the federal government to rise up to its duties, because since it began about 30 days ago, the sad thing is that the response we've been getting from players, from the actors in the federal government is their body language just that they are not interested in getting a solution. Rather, they simply want to model up things and fight back. Rather than the 30 days this strike has lasted for is enough to solve some of the issues that we raised in the ultimatum and the eventual in some of the issues that we raised that led to this strike. And it's sad that right now we have not made progress on just one out of all these issues. So I hope the fact that the NMA has thrown its weight behind the Nigerian Association of Resident Doctors would make the players in the federal government to sit up and solve this problem so that we can end once and for all.
Well, it's a fine place for us to say thanks. And again, apologies to you, Dr. Arome. Thanks for being such good company. Dr. Tuyi, health policy specialist, and Dr. Arome Adejo, who is the first vice president, Nigerian Association of Resident Doctors, Dr. Obabire Ayeyemi, who is the general secretary, Association of Resident Doctors at the University of Ilorin Teaching Hospital in Ilorin. For all those watching, remember, health is wealth, but poor Nigerians can't feed or pay hospital bills and die from diseases and malnutrition. The buck is on the government's table. They can't keep passing it to the poor people of Nigeria. Many thanks for being such nice company. See you again tomorrow. Bye-bye.